Hello, Protrusive. I'm Jaz Gulati, and welcome back to an interference cast. This one, I feel kind of selfish posting this one, but it was interviewed. It is about me today, right? It's my story, my origin, what drives me. But I was interviewed by a very fascinating dentist student called Nav Bhatti, and he's an up-and-coming content creator. And I liked his style. I liked his realism. Very real world. I always got time for people like that. He's actually a British citizen studying dentistry in Slovakia, previously having studied in Egypt and Ukraine. So he's got a really interesting story, and we didn't actually get time to unpack it because he came to my practice where I work and he shadowed for a bit, and then the plan was to record. But while recording about 25 minutes in, which is why this podcast is as long as it is, which is why it's a kind of shorter episode, my wife calls me, and you know, at this stage, it kind of sums up the entire sort of month I've had, right? My family has been plagued by illnesses. Like my baby, Sehan, 10 months, had like back-to-back viruses, and you know when the kids are not sleeping, we'll get like 2-3 hours sleep a night. And then unfortunately my eldest, almost 5 years old, he was in hospital for 2 nights on IV drip, severe dehydration, projectile vomiting, you name it, the whole shebang. And then it finally got to my wife as well. I was the last man standing. I kind of told the universe, and this is crazy, right? I heard Gary Vee say this once. He said, I told the universe I'm too busy to fall sick, right? And so that's my theory of why I didn't fall sick. I just told the universe, no, not today. But anyway, it's been a really challenging few months, and then it kind of got epitomized by what happened while we were recording, that my wife called me and she was in bed, she just couldn't move, and she had a baby, and I was like, oh my God, I better rush home. And thankfully, I live very close to where I work. And I said, Nav, I'm so sorry, I've got to go. And so the reason to share that with you is that just to remind you that we're all going to have bad months, okay? We're going to have bad months, bad weeks, and it's part of life. And one of my mentors, Lincoln Harris, once taught me that when you don't know someone well enough, that's when you think their life is perfect. And that really resonated with me. And I guess we always have to be careful, like when you listen to this podcast or any podcast or what you see, especially on Instagram, dangerous Instagram, right? Where you look at everyone's cases, think, wow, they've got it all made up, their life is amazing, Ferrari, Rolex. You just don't know what's happening behind closed doors, and no one's got it perfect. You don't, I don't, but we all must do this together. And togetherness has been a big theme this last month, because we just launched Protrusive Guidance, which is the new website. It's protrusive.app. So the old platform, we totally outgrew it. And so I did something very dangerous in business terms, right? So you guys know that your subscriptions are the reason that this podcast is alive and thriving today, right? I've actually given up a lot of clinical time. I only work 3 days clinical now, so I can focus on the teaching and the podcast. And I have a team to make sure that I actually get to see my wife and kids. And so things were going great, except we totally outgrew the old platform. When I realized that Protrusive, you guys were going on this rubbish forum that we had on the old platform, and you guys were like, hi, I'm so-and-so dentist from India, and this is what I like. And I was like, wow, this is beautiful. You guys are connecting, and I didn't envisage the community part to be a significant part of it. But I realized you guys actually crave community, which is why our Facebook group was doing well, and people, trust each other. Protrusive, trust Protrusive. But you know what? Facebook is because there's too many ads, too many spammers, and a lot of you aren't even on Facebook, and you message me saying, Jaz, how can I get involved in the community because I'm not on Facebook? Which is why Protrusive Guidance is not only taking all the epic content that we had, and now it's got a search engine, and it's just visually beautiful and a lot less buggy. Previous one I found it was starting to get buggy on my Android device. This Protrusive Guidance is just a whole level above. And so the business risk I took is I asked all of you to cancel your subscriptions, right? It's pretty crazy, right? I asked all of you to cancel your subscriptions, and I said those who want to, yeah, I wasn't forcing on those who want to come over to a brand new experience, come on over. And so this is a very risky thing to do, but I absolutely believe in the future of Protrusive and what we're trying to build here and our community, and I've just been blown away. Like your guys' engagement so far, how happy you guys have been with the platform. A few teething issues like Android, the quizzes aren't working on Android at the moment, but they do work on when you go on your Chrome browser on your mobile or the web. So a few teething issues, excuse the pun, but it's just been great to see so many Protrusive on Protrusive Guidance. It's on Android, iOS, but the best place to start, the best place to actually take a look at what we have to offer and choose a plan is protrusive.app on your web browser. And then once you have a login, you can use it on any device, including the native apps. So let's hear the episode about what drives me. And I guess in a nutshell, I'm all about being a learner. One of my strengths is learner. One of the 5 strengths I discovered by doing Tom Rath's Strengths Finder 2.0. I was recommended this book like 12 years ago, Strengths Finder 2.0. I've mentioned the podcast before, but if you haven't heard it, it's a really cool quiz that you do, and it gives you your top 5 strengths, and it argues that actually we should be working to our strengths. Weaknesses maybe a little bit, but actually let's focus more on our strengths. And one of my top 5 strengths is learner. And on the taxonomy of learning, when do you learn the most? You learn the most when you're teaching and sharing with others. And that's what my true passion is. And most of the time I don't have the answers, and I'm desperate for that knowledge, which is why I bring on amazing guests, some that are internationally renowned and some who don't have an international reputation. But you know what? Those episodes are just beautiful in the real world journeys of the protruserati. So I hope you enjoyed this slightly different episode, and I hope that you will consider joining us on Protrusive Guidance. It's actually free. If you want to just enjoy that community magic of the protruserati, it is absolutely free. So check out protrusive.app. There's also payment plans for the educational content and CPD for those that want it. And students, watch this space because something epic is coming for you. Anyway, enjoy, and I'll catch you in the outro.
First and foremost, I've been given an amazing opportunity today to speak to the world-renowned, I must say, definitely world-renowned.
That feels really awkward to me.
No, I'll be honest with you, anyone I speak to, no matter where they're from, and I have people that I speak to in America, they know you.
That's
Everyone
crazy.
knows you.
That feels crazy to me.
There is, so that's why world-renowned for a reason. And obviously, I've been to Egypt, I've been to Ukraine, I'm currently in Slovakia, and everyone knows you, and everyone's a big fan. So,
Wow.
As I say, world-renowned for a reason. I've got here podcaster, clinician, as we know, teacher, mentor, and of course, father. The great, the one and only Dr. Jaz Gulati. Thank you for having me today, actually, at his clinic. So
I appreciate it, Nav. It's nice when people come and shadow, but it's nice that we get to record. Not often someone comes and idea today, let's record together, and so it's good. And I'll be excited to hear about your journey as well through all these countries, actually.
It would not be as exciting as your career to date, I'll say that much, but we will definitely get into it. For me, first thing, as I said, thank you once again for having me in. And I think what we want to just kind of start off for anybody who doesn't know, and they should know, your background. Tell us more, because you're usually the guy asking the questions. So today we're going to flip that around and find out a bit more about yourself.
Okay, I think the most striking thing where I'd have to start, I think I'd feel compelled to start, is where the journey begins, your big why in life. And I think I can take everything back to when I was 6 years old.
Oh, wow.
Fled Afghanistan as a refugee, came to the UK age 6, didn't know a word of English. My father's still illiterate. Mum just about gets by. And so feeling incredibly grateful now when I look back that I received a British education.
Perfect.
And I got a chance. And I remember those days coming as a 6-year-old to England, and this new place, and fleeing all the bad stuff I was going with the Taliban, and being subject to racism, seeing some of that, being chased by skinheads on motorbikes, or like all sorts of things that I've seen in that regard. But I think that's all been made me resilient. We lived in a council flat for up until I was 24. So I went to dent school, and when I went to dent school, I was like, oh my God, I've got my own room. I've got my own bed. So that was a huge thing for me.
Right.
And if I was to show you where I live now, it's like a small little 2-bedroom, okay? But for me, it's a castle.
I'm with you.
So that's kind of the beginnings I come from. And I think probably the reason why I focus so much on education is that relationship I had, coming very hungry, and then trying to do the only thing my parents said, just work hard at school. They never had any more input on that, and then I just took that on board, and I tried to embody that.
Okay, perfect. And then to the next question, why dentistry? I mean, Asian background, yourself, similar in terms of origins, and I think one thing that we could probably agree on, culturally, it's very much driven towards medicine, dentistry, be a lawyer, be an engineer, something along those lines. You just said your parents didn't give you that kind of pressure. So what made you think, actually, dentistry, maybe not medicine, for example? What was the key driver there?
Definitely no parental pressure. Like I remember doing my A-levels, and my mum was laying there, and she was like, Jaz, what are you doing at the moment? And I was like, oh, I'm just working on this project. No, like, what do you do? Are you doing English, math, science? Like, what do you do? And I'm like, beyond GCSE, like she had no idea what I was doing at school, right? And so that's the kind of level of input my parents had in that regard. But I'm still grateful that they still made a difficult journey and decision to come to a brand new country and set up the foundations for me. So I'm still grateful. But in that way, I had no pressure. So it's very much my own choice.
Yeah.
Like if it was up to my dad, I would probably be doing eBay. Like my dad was like at a time where he owned these 2 corner shops, one corner shop at the time, and I kind of did a bit of work experience there, and I got to see what life was like in that regard. And then he was like, oh, so-and-so's son is doing, making a lot of money on eBay and that kind of stuff. This was maybe, what was it, like 2005 and that kind of stuff.
Oh, so just when it was breaking through.
Yeah, exactly. Yeah. And so my dad was like, why don't you do eBay kind of thing? And it wasn't on my radar kind of thing. I just wanted to be a dentist because I had this one upper left central incisor, which was like, about like a dilacerated almost, so sticking out. Very embarrassing, hated it. Yeah. And then when I had that treated orthodontically, completely changed me as a person. Like completely brought me out of my shell. I just wanted to bottle this up and spray it everywhere. Okay. And it's very cliche. A lot of people say, I had ortho and therefore, but it was my own personal experience. And I thought, okay, this is what I'm gonna do. In fact, if you'd asked me at dent school, I wanted to be an orthodontist.
Okay.
When I got through dent school, I was like, I want to be a restorative dentist, I want to be a specialist. And now I'm just a general dentist.
Okay, so you're clearly not just a general dentist. I've just spent some time upstairs with Jaz, actually, been fortunate enough to shadow. And I've seen stuff that I have never seen before. And I've shadowed a few dentists in my time. Most of the
If you come on a different day, I would have been seeing little old ladies with the lower left caries, premolar root caries, but luck of the draw that you came through.
True, but I would say one thing that I picked up with most dentists, and maybe that's what most of the public perception for dentistry is that they will look for the quickest and easiest fix and try to get you in and out the chair as quickly as possible. What I saw today was, a lot of empathy and understanding of the patient, and it was very patient focused, and it was what I felt from my lack of experience, but for want of better words here, you really did focus on the treatment and not just the time involved. It was very much focused on what's the patient feeling and how can I make sure they have an easy journey through this. And this wasn't the end of the journey for the patient. Your patient's coming back, of course, for the rest of the treatment as well. What makes you have that feeling of I need to focus on the patient and not my bank account? Because a lot of dentists, with all due respect, I would say I'm quite money driven myself, in all honesty. How are you not tempted into the dark side? What keeps you looking out for the patients?
Good question. And I see that, sometimes when you're there and you've adjusted this denture 50 times now, and you're there calculating your hourly rate, and you think I would be better off working at Tesco's, right? Sometimes you have those patients, right?
Yep.
Other times you're winning. Sometimes you're losing. I think when you stop focusing on whether you're winning and losing, and you focus on quality, that relationship, the patient. I was always taught at dent school, I had some good mentors, and they taught me if you do a good job, the money will come. If you refine your skills, the money will come. I can definitely vouch for that. I mean, the more I invest in my skills, like what you saw me today, that machine I was using, the T-scan, right? So
amazing,
guys, I was doing this T-scan assisted equilibration, so disclusion time reduction on a TMD patient, a purely muscular TMD, a real live wire, as my physio called her, basically, crazy referral patterns everywhere. And so we're trying to get we're closing her AOB, so anterior open bite with Invisalign, and to get a nice occluding scheme on her own teeth.
Yep.
She will go on to have retainers and occlusal appliance, but what I was doing with her was using this T-scan, and that T-scan cost about £8,000, right? So the training with that spent £1,000. The kit itself I bought myself. I kind of pitched it to the principal, was like, but if you're the only one using it, so then now I've got this arrangement. If I use it and I charge for it, like a subsidy, I get that basically, right? So it's paid for itself.
Yeah.
But whether or not I was making money from it wouldn't be the main thing. It's about actually getting the outcome. So I told you that what I liked about it is I'm not chasing red and blue marks on teeth. Yeah. I'm led by data.
Correct.
And that me feeling as a safe practitioner that I can adjust this, and then medical legally, I've got all those scans to show that, okay, what was the occlusion like before? What was the occlusion like after? You don't truly get that from a photo. So I invested in it, not to get money back at the end of it, but so I can give better care. It's a bit like an endodontist investing, £50,000 on a microscope.
Right.
The patient's not going to pay any more for it, but you're going to get better outcomes.
Correct.
So I've got your question now, mate. You said about the patient.
It was about the patient. What keeps you focusing on that and not the money? And I think you explained it quite well. That at the end of the day, it's more so you're investing to ensure that the patient's happy with the outcome, but also for yourself that you're not really cutting corners doing it, and it's a long-term investment. And I think, again, when you do speak to not all, but a fair few general dentists out there, it is more about just, can you reduce chair time and can you just increase input output. So
that's important as well. I'm not a practice owner, but that's important to respect your time as an associate. I've got a friend, Sunny, DRE Composite. He talks a lot about making sure you value hourly rate and how to improve that with composites and that kind of stuff. It's important.
Yep.
But it's not the only thing, right? You want to go home, you want to sleep at night knowing that, you know what, I did a good job. You want to have fun. To make dentistry fun day to day, to fall in love with the little details. That's where the longevity of your career comes from. If you focus on just the money's numbers. Numbers never finish.
Yeah.
Eventually, if you focus on just the money, there'll come a time where you are, clock watching, you're not involved. But if you're actually there to visualize the end result of some treatment, to really care about the mechanics of what you're doing, to fall in love with the little details, gamifying dentistry, if you like. That's where I think the longevity comes from.
Okay, that's a very good point. I think I need to do that. I'm a bit of a gamer myself, so I think I need to take that tip on board and try to enjoy the process as it goes along. So my current situation, being a student, that's my process. Let's wind the clock back a little bit. So which university did you study at?
Sheffield.
Sheffield, right. And for the students out there, what would you say were the highlights and the lowlights of your studying process? So not the dentistry now as it stands, but if you can think that far back, let them know.
Highlights is just, it was a great time, the community of these 80 odd people that you follow through in 5 years, the social aspect, partied a lot in first year, especially second year, and then towards the end, I got a little bit more level-headed. But it was great. For me, it was like living out for the first time, getting my own place. It was very special. But then obviously the dental school aspect of it, it's like you're the sponge, and you're there to learn. But it can be a little bit dark as well. I mean, I guess the low light of it, and I've spoken about this before, is whereby, and a theme of my life now is when things get difficult. When you're stretched as a husband, a father, a dentist, a content creator, when all these things are pulling at me, when my patients are emailing me, I've got 5 different inboxes and they're full, right? And I feel that pressure, right? And stretching you. The thing that often has to give way is health.
Right.
Whether that's through sleep or no longer going to the gym, no longer looking after your body or your diet. And so during dental school, I had this strange fixation on I want to get 100% in exams. It was stupid. I look back now and it was just stupid because no one ever hires anyone thinking that, okay, what percentage do they get in finals?
Never.
It's BS. It's all about your emotional intelligence.
Correct.
But at the time, I was just determined. I achieved it. I was the first person to get 100% in finals exam in Sheffield. Okay, that was one exam basically in finals. But at the cost of my health at that point. Right. I stopped going to the gym. I was literally just not in a good place. So that's a dark thing. I wouldn't recommend it. I want students to find balance. And I would have done fine,
without
all that, exactly, without sacrificing my health.
Of course.
Hi guys, it's Erica here, the producer of Team Protrusive. I'm just interjecting here with the announcement that we've now got this amazing community platform. You can access it from your laptop. It's called Protrusive Guidance. There's also a native Android and Apple app. What we really want to do is to harness the power of the Protrusive community and create a platform we can share and grow together. And you know what? It's way better than Facebook. So if you haven't already, check it out. Just do bear in mind that we manually approve every single application. So it might be a little bit slow to approve you. But we only want dental professionals on this network to keep it a safe place and so that we can share failures together. Head over to www.protrusive.app to know more.
Because I think that's the thing that we see nowadays, that dental students are almost falling out of love with the profession itself, just simply because the amount they're putting into the studying aspect. I see students as well, they're burning themselves out before they even hit the chair, for example. So it's one of those things that hearing it from yourself as well, it's seeing yourself now, you're successful where you are, and that's great. But even you've fallen prey to that. So what would be the best way to give advice to these students that are trying to push for the best grades and really killing their social life to just keep a balance so that they still enjoy dentistry at the end of it? Because one thing that I kind of see is dentists, they come out into the world and they're just grumpy. They hate everything because they've hated dentistry now. They've despised the trade. So by the time they're out there with their patients, it is basically how much money can you bring in? So I think what you've done is you've fallen in love with dentistry and therefore you love treating patients and all the rest of it, which is good for everyone. Now, how do we make sure that students that are currently in that university aspect, how do we make sure that they're not making the same mistakes that you might have made? So what would be your advice there?
I would firstly say it's a noble thing to want to do well at university. It's a very noble thing, right?
Sure.
To desire that for whatever reason. You want to make your parents proud, you want to do it for yourself, you just want to master something, even if it's as a dentist student, you master a book, right? You can't actually master anything except memorizing the words, right? It's like a memory test in a way. So it's a noble thing. I wouldn't discourage trying to aim for the best.
Yeah.
But you have to draw the line somewhere, right? To see, okay, what are the sacrifices I'm willing to make? And if I ask myself that now all those years ago, I wasn't willing to make my health sacrifice, but I did. And I just need better ground rules to understand what I'm trying to achieve here and for what reason. And number one thing to remember is your grades at dental school will totally not determine your success in the future. Your emotional intelligence, your charisma, your network, how nice you are to patients, the quality of your care that will eventually build on time. But these are these are factors that are going to determine your success, not how much you scored in these exams, right? I think when we focus so much on the books and less on people, we have to remember that dentistry is a people business.
Yeah.
And so the more you remember that, and remember that, okay, you're better off in your final year of dent school to do the bare minimum to get the pass, but then the rest of the year, go to Toastmasters, which is like public speaking. Put yourself in awkward scenarios. Learn about body language. Learn about the art of communication, talking to people, getting out there. That's going to be far more important in your success in the future, I think.
Okay, that's actually fantastic advice. And I think that's somewhere where people do slip up, that we focus way too much on the educational side of things. So take that advice on board for anybody listening. That's huge. I think people skills is so underrated and undervalued, but in reality, that's kind of what takes you on to the next step in your career and with your patients as well. So amazing advice. Thank you very much. Let's move it along. So you're a massive advocate of TMJ as a whole, the temporomandibular joint, and TMDs, the disorders of. What pushed you into that, other than the story about the orthodontic side of things and obviously your teeth being dodgy from the start and all the rest of it you said earlier? What made you really focus in on TMDs as a whole thing? And that's basically made you who you are. That's your brand, essentially, what people know you for. So guide us through that journey and what made you get there at the end.
It's a scary one when I think about it, because I often think, am I doing the right thing? I'm on the right path?
Right, okay, interesting.
I booked a call with someone recently. I can't reveal who, but this is like someone who's really up there in the world of TMD, academically, especially, but clinically as well, but very academically.
Yep.
And I arranged a meeting with him just to talk about, okay, if I'm committing to this, what do I need to watch out for? Because when you start treating patients with chronic pain, things can become very tricky for you as a person. The communication required from you, how you deal with people's emotions, managing expectations. And so, famously on some videos that I did 2-3 years ago, an episode was called, I think it was episode 39 or 40, it was like, stay away from TMD.
Oh, okay.
And I said, are you sure you want a queue of paying patients outside your door? Right? Yeah. Because I kind of now miss doing more standard dentistry. I love doing crowns, I love doing tooth wear and stuff, but I'm seeing more and more TMD. It's a double-edged sword because I love helping people with pain. I love getting a diagnosis, getting into all the detective work, get the right diagnosis and explain that to a patient and figure out, okay, what are the different ways to go? And with that, I do still find the more deep I go into TMD, and I've learned from several different courses and people.
Yeah.
But I still find that it's the Wild West when it comes to TMD. It's the wild. I mean, you can do all sorts. So my philosophy at the moment, 2024, what's my philosophy right now? Might change 5 years later.
Yep.
My philosophy right now is get a diagnosis, figure out, okay, what are the range of treatment options we could do, and if it aligns with the patient values, do the most conservative first. Try and do the most reversible. That's some, people say, splints are not a cure and then that kind of stuff. And I understand that and I see where that comes from. But I believe in symptoms modification, i.e., if I can modify your symptoms, like I told you about that email I got from the patient, right? He's got a Coy-Steer program, and we don't want to go into that basically, but he's feeling like he's had pain for 11 years. And he just emailed me saying that, wow, this is amazing, right? So to have that impact is absolutely brilliant. Yeah. But by modifying his symptoms, now I feel okay to recommend to him to have orthodontics to improve his overjet. Now I feel okay about that. I feel like with chronic pain, anything that's been longer than 3 months, what the evidence suggests, which isn't amazing evidence, but the evidence suggests is that actually the more hands-off, the better. I don't fully believe that, but I have to respect it because that's the evidence. So in a roundabout way, what I'm trying to say is, I'm sometimes worried about, am I in the right space? Because it is I do find it challenging. I'm not gonna lie. I sit down, I do a TMD report, and it takes me a lot of time because I really want to proceed carefully. It's not like caries removal, like it's very definitive. You restore it, tooth extraction, restore it. With TMD, it's a whole patient's emotion side of things. That's what I found the toughest, right? Because they want me and they want me for life, and they email me and stuff, and I've got to be there. I've got to be their advocate.
Of course.
So when I spoke to this guy about the top dog in TMD, and I spoke to him, he told me, "Do you have a contract with patients?" And I'm like, "No, I don't." So I'm going to continue some mentoring sessions with him because he's got 20, 30 years on me.
Right.
And so I appreciate that you see me as this up and coming TMD, but I'm very, very careful. I don't know if you've seen on social media, especially on my personal Instagram, I very rarely would advertise to patients that if you've got clicky joints, come and see me. If you've got
True.
I talk more about family now and cosmetic stuff. I'm already swamped with TMD patients, like already swamped, and it's more than I can handle. And it takes like a lot of personal strain to manage these pain patients. So whilst it's very rewarding, and it's a thinker's game. Professor Oakson, in Kentucky, he says that TMD is a thinker's game. I like that. But I'm constantly like, is this the best thing for me in my future? And I'm committed to it. I want to help my patients in pain, but I am perhaps from an outsider looking in, they say that Jaz, he's a bit too conservative. He's a bit too cautious. And that's me right now. And I'm happy here.
Right.
I might change in 5 years.
Yeah.
As either new evidence comes to light or my own personal experiences change.
Yeah.
But I'm very careful about over-promising and under-delivering when it comes to pain patients.
I'm with you. That's a perfect response. I think for anybody, I know there's a lot of people that are full-on dentists. They know their stuff inside out. But anybody who's coming through via my route is probably a student and won't know much about TMDs. So would you be happy to do like a 60-second or a bite-sized crash course on TMDs, what they are, and the importance of treating them in comparison to just typical dentistry as we see it?
Okay.
So that anybody who wants to know what the hell we're talking about, because we're just throwing TMD, TMJ at each other, it will give them a bit more insight.
Okay. TMJs, there's two of them. It's a joint. It's anatomy. Don't confuse TMJ with TMD. TMD is a disorder. TMJ is anatomy. TMD isn't even a diagnosis. There's many different types of TMD, okay? So you have purely muscular TMD, right? Because the stomatognath system is full of teeth, muscles, joint. Even the joint has got capsule. It's got so many parts of anatomy that you should learn first. So if you want to not embarrass yourself in the future when your patient comes in with that TMD emergency, firstly, and serve your patient, number one thing is learn anatomy of the TMJ and the muscles. If you can learn anatomy of the TMJ and the muscles, you're pretty much halfway there. Combine that with a history, and then you can get a diagnosis. And then how do you know the range of diagnoses? If you look at the international classification of the TMJ disorders, they're all there. So if you know the anatomy, you got the history, and you look at the different diagnoses there are, you can actually begin to start making diagnoses. Only when you can start making a diagnosis can you think about helping a patient.
Right.
And so that's my 6-second crash course, if you like.
That was amazing. And then you'll end up in this crazy Wild West, as you called it, where Jaz is sitting at the moment. And good luck to you if you follow that route as well. So that's awesome. Thank you so much. I had questions from people online, actually, specifically for you, because we did a little Q&A thing. The first thing actually ties in with family. So we had a message from a girl who said, I'm considering doing dentistry, but I want to have kids in the future, near future. Does it work?
100%.
Okay.
Like mothers who want to, like, say, work part-time and stuff, in the right place, right environment, you can be supported. You can, the world's your oyster, but to have kids and be a part-time dentist in that phase of your life works really well, I think.
Okay.
Especially if you happen to be a practice owner or something, then you can manage your own hours. If you want to work 10 till 2, you could. I know it's a bit of a unicorn in some ways. What I'm trying to say is you can totally fit dentistry around your children's life.
Okay.
And it's something that pays more than most professions. So even if you're working part-time during that phase of your life, you can still be doing financially well to support your family.
True.
I think overall it's a great profession, and so that includes being a parent.
Okay, perfect. Let's give you 2 more quick ones, and then we'll wrap it all up. Why is dentistry better than medicine? This is actually a question I got through. So in your words, you can't say it the other way around now. You have to stick with the statement.
Okay, why is dentistry
better than medicine?
Okay, because I get to look down someone's mouth rather than look up someone's ass. Did you know this one already?
I always advocate for this. I always say I'd rather my fingers going one way than the other way. So this is, look, we think alike. Okay, perfect. And the last one I've got is from somebody who's actually had a really bad experience. He said, I feel like the dentist that I went to was like a mechanic. He went in there and just found problems, right? Mm-hmm. And maybe this is public perception as well. One, how do I find the right dentist that I can trust? And two, how do I know that they're not just fobbing me off and finding problems that they're going to make me pay for? What would be advice for most patients out there?
It's a real tough one. I see on YouTube, even though the podcast is for dentists, I get loads of patients commenting. And my stock answer is, look, I'm not here to give advice on YouTube. It's not what I'm here for, right? I'm here to serve my dentists and raise the game of education. But now and again, I'll give some, like, do this, do that. And the number one advice I give is, they're there doubting their dentist. Just have a conversation with your own dentist.
Yeah.
Right? And it's totally fine to get a second opinion. But if you're getting a third, fourth, and fifth opinion, then maybe something's wrong with you, not with the dentist, right? So second opinion, cool. Maybe third opinion if it's really complex, but it's totally cool to get a second opinion. And it's totally cool to question what your dentist is doing. But ultimately, you got to trust in your dentist. You always have to put the trust in. Now, if you find that you can't trust that dentist, then that's where the second opinion comes in handy. Right. Eventually, you'll find someone who communicates in a way you can resonate with, who then you can trust. And once you trust them, then it's very difficult in dentistry because most issues are painless.
Yeah.
And that's why the patient trust issue is there, because most issues are completely painless. Mm-hmm. Caries, unless it's to the pulp, it's often painless. And so I totally understand why patients are skeptical, but they have to at some point latch onto that individual that they're not buying the dentistry, they're buying Nav.
Yeah.
They're buying you. Okay, I like this guy. I like everything about him. I trust this guy and the way he explains things. I would like him to do it. If it's aligned with my values and budget, and if it's if my values and goal is I don't want to have pain anymore, I want to keep all my teeth, then great. But if you're suggesting something that's not in line with my goal, then of course that's different.
Perfect. And that obviously goes back to the point that you made earlier about it's all about interpersonal skills as well, which is very important.
Always. You can have the best crown margin in the world, right? The patient's not going to know.
Yeah.
But you've got the worst crown margin in the world, but you're so sweet to your patient. Right? I'm not advocating that. I'm not advocating this, but it just, the value of communication and just being nice to patients.
Yeah.
It's a really great one, actually. 3 things, and it's not mine, it's a dentist called Amin Aminian who came up with it, so I read it in a book, is that 3 things, okay? If you could do 2 of these three things well, you probably won't get sued, you probably won't get in trouble, okay? It's 3 things, okay? Doing the correct treatment plan.
Right.
Doing it well. And being nice to your patient.
Uh-huh.
So you might have done the wrong treatment. Like it really needed ortho, but you did veneers wrong. But you did really good veneers, and you're really nice. You're going to be okay.
Yeah.
Right.
Yeah. For sure.
If you did the correct plan, you did it really well, but you're rude to your patient. Well, you're technically excellent. You're probably going to be okay. You see what I mean? But that's an easy one to get at the end.
I'm with you. Keep those on. Definitely keep those in my head. That's perfect. Honestly, I can't ask for anything more from you. I think this has been an amazing insight.
I'm sorry I have to be cut short.
No, we'll definitely reconvene over the summer. Yeah. I'm sure we'll find
We'll continue on our usual route online, right?
100%.
We'll just
we can do it from there, no problem. And like I say, it's been a pleasure. Thank you so much. I'm sure everyone's going to enjoy this one. And I hope to be seeing you again soon, my friend.
Appreciate it.
Thank you very much.
Thanks so much.
Thank you.
Cheers.
Right.
Well, there we have it, guys. Thanks so much for listening all the way to the end. We had to kind of cut it short, obviously, because I had to go and attend to my wife, and she's absolutely fine. She's an absolute soldier. It's actually Valentine's Day today. I'm recording in the morning, so I'll be taking her out for lunch today. I'm not the most romantic person in the world. I'm a typical bloke. In fact, I was going through Google Photos, and I was searching for, in Google Photos is brilliant. You can actually search for, Jaz wearing orange, and it'll find all the photos of me wearing orange. So I typed in romantic photos, right? And I had to scroll a long way to find photos of me and Sim together, basically. And they all seemed to happen before we had kids. So there we have it, guys. I'll be taking my fair lady to a nice lunch. I hope you guys had a good Valentine's Day. I hope you enjoyed that post I made on protrusive guidance with the endo access cavity on a molar in a heart shape. And if you're not on protrusive guidance yet, head to protrusive.app. And of course, I look forward to interviewing Nav in the future to find out about his fascinating journey. How did he end up at 3 different dental schools well into his 30s, and what drives him? Bye for now, and catch you same time, same place next week.